So basically, it's a very important question which you have asked. And first of all, hi everyone. And so I was, let me start with some background, and this is looking at the data collected by NCAER. This is the income household data. And what the data is saying, that the median income for India is close to 3 lakh rupees per year. And if I'm looking into the per capita average income, it is close to 1,60,000 rupees per capita per annum. And 80% of the population in India actually have income less than this average annual per capita income, which is 1,60,000. And if you're in the top 1 percentile of the income population, all you have to do is to have an annual income more than 15 lakhs rupees per capita per annum. So you can very well understand from these numbers in terms of distribution of income how skewed we are. Now, when we are talking about the coronavirus, some of the other thing which you have come to know, and let me again throw in some numbers. If I'm looking into the number of death as a percentage of people getting affected, across the world there is a huge variation. Like what we see in terms of income distribution for India, we also find, if I'm looking into the number of people who are dying as a percentage of total people getting affected, also varying quite a bit if you look at the standard deviation. For instance, in US, as we are talking about, as of now, there are close to 0.9 million people who got affected, out of which you have close to 53,000 people dying. So as a percentage of total number of people getting affected, for US it is 5.7. For United Kingdom, it is 13.6. For Italy, it's 13.5. The good news is for India as of now, if I'm looking into the number of deaths as a percentage of total number of people getting affected, it is only 3.1. So if we were to control for the population size, the best way to look into the figures would be to compare Indian states. For instance, if I'm looking into Rajasthan, which is more or less similar to that of the UK, you will find that for Rajasthan, the number of death as a percentage of total affected from coronavirus is 1.4, as opposed to UK, which is 13.6. If I'm looking into UP and Bihar combined, you will find that this number are only 1.4, as opposed to US 5.7 death. So it's kind of counter argument, So because US, UK, they spend close to 6 to 10% of their national income. Actually, for US, it's actually 16% of the national income they spend on healthcare infrastructure, and for UK, they spend close to 8% of the national income on their health infrastructure. For India, if you take states and center combined, the figure comes to around 3.89. And if I'm looking only at the central government, the figure is only 1.5% of the GDP, which they are spending on health infrastructure. So what is surprising is, in spite of India spending so less, yet in terms of the number of people dying as a percentage of total number of affected persons, is quite low, and this number is true across some of the other countries. For instance, if I'm looking into the countries with similar level of income pattern as in India, for instance, Bangladesh, for instance, if I'm looking into Ethiopia, for instance, if I'm looking into Tanzania, there also you'll find that although our per capita income is quite low, for Ethiopia, Tanzania, Bangladesh, the level of mortality is quite low, as opposed to what we are seeing in the context of USA, UK, Italy, or Spain, or some of the developed countries. So the first thing which comes to our mind is, why is it the case? And if you talk to some of the critics, they would argue that we are actually testing less number of people. But even if I'm looking at death as the total number of deaths, and try to do a counterfactual experiment, which is, if I'm looking into the total number of deaths between 2018 and 19 and 2019 and 20, you will find that not too much of difference is happening in the context of India, as opposed to what we are seeing in the context of developed countries, and one reason for this, or maybe two reasons for this, has to do with the fact maybe for countries like India, Tanzania, or Nigeria, or Bangladesh, we have much younger group of population which are more immune to handle this virus as opposed to what we see in the context of developed countries. Now, why I'm telling you all these statistics? For the simple reason is here we are talking about a very important condition, which is lockdown. Because I just now shared with you this number that 80% of the Indian population are actually having income less than 1,60,000, and these are the population who are mostly into migrant labor or agricultural labor. So when the lockdown happened, the first thing which is quite natural instinct for them is they went back to their native state. Now, another important thing, I don't know whether you guys have noticed or not, is unlike other type of diseases, for instance, if I'm talking about tuberculosis, if I'm talking about cholera, if I'm talking about let's say pneumonia, or even road accident, you will find that compared to what we are seeing death in corona, compared to these other diseases, are quite low. But the important point to note here is whenever we are talking about tuberculosis, whenever we are talking about diphtheria, whenever we are talking about measles, whenever we are talking about uh, pneumonia. So uh, the these are typically happens for the people in the lower income strata. So the basic difference between what we are seeing in the context of corona vis-a-vis these other diseases with much more death rate compared to what we see in the context of corona is for corona you have this impacting across the income distribution. So the corona is in that way is a very level. It's actually operating on a very non-discriminatory fashion, if I may say so. Because again, if I'm looking into the number of vaccination for be it for measles, BCG, or diphtheria, you will find that most of us who belong to the middle income or the higher income category, we actually ensure that our kids are vaccinated properly. And because of that, the outcome is very seldom you will hear your friend or people from your level of income background actually suffering from cholera, pneumonia, or any other this communicable kind of diseases, which is not the case for COVID. Because in COVID, the rich and the upper class, they don't know how to handle it because it is actually impacting all of them. And when we are talking about the livelihood, this is something which Anirban mentioned. Although he hates working from home, but the good part is he was able to shift his offline duty into online duty. The same is for me. I mean, I'm just now talking with all of you over online. So for most of the people who are in the banking profession, who are teachers, who are, let's say, IT professionals, for them it's not too much of problem with the difference in their livelihood. Their livelihood is still continuing. But for this 80% of the people category, there are close to 120 million migrant workers in India. Most of them are actually construction workers or agricultural laborers or helpers in a restaurant and things like that. For this type or for this group of people, who otherwise, and that's why I shared the data about the death rate in India, who otherwise may be asymptomatic in terms of they are not having any symptom and they are perfectly fine, but they are not able to work, and that's a problem. And so what I'm suggesting is, if I again look into the district level data, you will find close to now 60% of the Indian district out of 650 district are the ones which are kind of getting impacted because of the spread of coronavirus. The remaining district are what the government is calling as green zone, meaning that it is not that much impacted. Now, if you see in what way this group of people who are in the lower echelon of the income strata are getting affected, First of all, they are moving into value added into some services with a lower value addition. For instance, the guy who is to drive, let's say, auto, or who is to run his small restaurant. Now the restaurant or the auto driver profession as a profession is closed. Or for that matter, the guys who are in the business of who work as a decorator for any function, so their business is gone. So what we are seeing is most of these auto drivers, they have taken an alternate profession of as a delivery boy. I was told by some of my friends in Calcutta is some of this decorator, they have now transformed their this business, and they're running salon. They have transformed into barber. So why I'm saying that this is actually a fall in value addition, because as an auto driver, the amount of earning you are having is certainly higher than what you are going to earn now as a delivery boy, because that's not your profession. Or for that matter, so we are seeing a shift. Not only the economy is contracting, but also there is a shift in activity to a much lower value-added jobs compared to what you were doing earlier. So I was again checking at some data during 2008 financial crisis. In terms of value addition, our economy contracted by close to 12%. And this time, within this span of 3 or 4 months, from the time the corona thing first came on the news, starting January, if you look into the data, the real value addition of our economy has contracted by more than 20%. So what happened during the context of US financial crisis, 12%, now within a span of very few months, you see a big contraction happening in terms of the gross value addition, which is happening in the economy. And of course, all of you know that even IMF is now projecting an income growth of only 1.9% as opposed to our initial projection of 4.5% during later half of the previous year. So that's a big contraction. And who are the people who are going to get impacted most? These are the people who are in the business of this hand-to-mouth profession, be it the laborers, be it the restaurant, small-time restaurant operators, be it, let's say, someone who was driving. So ideally, what the government should do, and there are some precedents. If you look into Orissa and Kerala, this has been touted in most of the newspaper. What they are doing is they are trying to target the people who are actually migrant labor and who has lost their livelihood. And what is happening is the government is ensuring that the public distribution system is operating properly. And also they are getting access to this universal basic income, that 2,000 rupees that the central government has promised to give to them. They are getting it, and that's why the Kerala model and in fact, for the Kerala model, they are also doing lots of more testing compared to Orissa. And on the other extreme, you have the Bhilwara model, which is a district in Rajasthan, which basically performed this lockdown in the most stringent fashion as possible. So to kind of give you some, to wrap it up, so we'll have to look into this lockdown with a human face. We have to ensure that we are reaching to the target group, because this belongs to 80% of the Indian population. We have to ensure that their livelihood is taken into account. And only then I think we will do a good job, because this group of people are the least one who are going to die, if I may say so, from this coronavirus episode. So I'll stop here. Would be happy to take any question you have. Thank you.